Hello, good evening, everyone. I am Dr. Ryan Baldomero. I'll be your moderator for this evening. Welcome to the Lamp Wellness Foundation series of lectures. I'm looking forward to this lecture because shoulder pain, when we look at Philippine statistics, it is one of the top 10, neck and shoulder pains is one of the top 10 occupational diseases. Actually, it ranks fifth, no, so it's very timely. It affects mostly our middle age to group wherein it's more laborious, and we tend to have a lot of um, people that work for BPOs, and it really does affect them in neck and shoulder pain from um, positioning. So without further, our present presenter doesn't need any further introduction. Is
Okay,
He is well loved by everyone and also a good authority
thank you.
on the field of TCM. So let me give to you Dr. Hector de la Cruz.
Thank you for that very kind introduction, Dr. Baldomero. Let's start. Okay, our topic for today is all about shoulder problems. However, we shall only tackle the quick and comprehensive approach to treatment. And as Dr. Baldomero mentioned, shoulder pain is a common problem, no? And in terms of its success rate with acupuncture, it is one of the easier musculoskeletal disorders to treat. So today we shall present only 4 treatment options that we commonly choose from. This is actually a personal favorite, all of which are effective and easy to execute, in my opinion. The practitioner is encouraged to review and select those that he or she prefers and that can best help the patient. First, regardless of the treatment selected, have the patient explain the etiology of the problem, its duration, intensity, what makes it better or worse, and other relevant characteristics. Determine the range of motion the patient has by having them move their arm and shoulder in all the normal movements, like rotation, so both lateral and medial, abduction, adduction, flexion, and extension. So for those who are enrolled in our basic anatomy and physiology class, so you know what we're talking about. And you have to evaluate the type of impaired mobility they have. So let's talk about auricular acupuncture. Personally, I typically choose ear massage and treatment as my first and most successful therapeutic modality. So I'd like to call it auricular massage or ear massage because it doesn't sound so foreign. Okay. And the patient would immediately feel comfortable, no? So it is my first and most successful therapeutic modality because of my affinity for auricular medicine and its proven effectiveness. In the ear, locate the shoulder point. Okay, this is the shoulder point. If the problem is musculoskeletal, or you locate the shoulder joint if the problem is confined to the joint, the shoulder joint. So pag musculoskeletal, you choose the shoulder point. If it's um, confined to the joint, you choose the shoulder joint point. Vigorously, you rub the chosen ear point. So you have to use this, uh, we call it ear pellets or ear seeds, between your thumb and index finger. And you have to do this with the patient seated, not lying down, huh? With the patient seated or standing. And let the patient know, or they need to anticipate that they will feel a very strong sensation elicited by the rubbing. Okay? And perform this step for only 15 to 30 seconds. So you decide which point, shoulder point or the shoulder joint point. The stimulus will be very intense and the patient may grimace or tell you it is painful. Okay? So after this time span, 15 to 30 seconds, have the patient make the shoulder movements that were performed earlier. In most cases, if your ear point location was accurate, you achieve the desired stimulus. No? That is why I always encourage everyone to have an ear probe, an angled ear probe. Okay, you will see it later. So if your ear point location was accurate, you achieved the desired stimulus. What is this desired stimulus? There is a strong sensation and or there is heat, no? And the patient can tolerate it. So there will be 50 to 100% improvement in the shoulder. If this technique has been effective, but you feel the shoulder needs further reinforcement, you can affix this kind of pellet. Okay, we got this from one of our very respected. You can email me or you can message me where you can get these pellets from. Do you like it? Okay. Uh, if this technique has been effective, but you feel that there needs to be reinforcement, you can affix this, okay? Or you can use an ordinary ear seed to the point so that the patient can retain it for about 3 days, okay? Instruct them to rub it gently 3 to 5 times a day for about 3 to 5 seconds each time. And at the same time, to mobilize the affected shoulder. Now, if their shoulder problem is along the large intestine channel, okay, you can determine if it is the large intestine channel that is involved, if there is difficulty in abducting the arm, okay? Abducting. So that's the large intestine channel. Select the shoulder point on the contralateral side, the opposite side of the patient's shoulder pain. Okay, what is the reason for this? What is the reason for treating the opposite side? Because the large intestine's divergent channel exits at LI15. And so the point on the opposite side will treat the shoulder pain. Okay, so choose the opposite side if you are quite sure that it is the large intestine channel that is involved. Contralateral. Now, if the pain is more posterior, that is, they're along the scalene muscles or in gallbladder 21, so it's more posterior, select the ear point on the same side or ipsilateral as the patient's shoulder problem. So if it's more posterior, same side. Okay? Now, next is needling lung 7. Another interesting treatment of shoulder pain, especially if it appears anterior to the acromioclavicular joint, is to treat the lung. Okay? So usually, if there is pain, when you ask the patient to touch the opposite shoulder, that is probably the lung channel that is involved. Remember, the lung channel internally transverses the shoulder area where it exits at the lung 1. Okay? With the patient reclining, so this time the patient should be lying down. You needle lung 7 transversely, 0.5 to 1 inch, or 0.5 to 1 soon, proximally. That means pointing towards the shoulder. Okay? Because you wanted it to be more yin. Okay? I know, to be less yin. Sorry. Because there are cases where the shoulder pain is due to dampness. So that means there's a lot of yin. So you have to reduce the yin. Okay? That's why you have to be pointing the needle proximally, that it means towards the shoulder. Now do this unilaterally on the side, so only one side, on the affected shoulder problem. In this instance, you are using lung 7 as a longitudinal luo connecting point. Okay, that is as a connecting vessel on the lung channel so that it can send a stimulus to the lung organ or channel complex. So after attaining the Da Qi, okay, use a vigorous dispersing technique or sedation technique. So we prefer speed and large amplitude for 5 to 10 seconds. So it should be mabilis, okay? And the patient should feel the qi go strongly up the arm because you're trying to sedate or disperse. So the patient should be able to feel the sensation going up the arm. Then remove the needle. Remember, 5 to 10 seconds lang, pabilisan. Then remove the needle and have the patient mobilize the affected shoulder and evaluate therapeutic success. There can be substantial improvement, believe me. Okay? Next is using twina and or needles. If the problem is directly at the shoulder joint, precisely at LI15, two options are possible. You can do twina and or needles. So with the patient seated, okay, so the patient is seated, vigorously rub this area, LI15, okay, with a deep and rapid manipulation. So rub this point 200 times in this manner. Most patients can tolerate such a strong sensation for that length of time, nor can, most patients cannot tolerate, no? Because you'll be doing it very fast, very, very strongly. And not all practitioners can execute this technique. To be honest, I don't like this technique. I would rather needle. So looking at the patient, you have to observe the facial expression. No? We monitor how the treatment is affecting them and rub with a deep, precise, vigorous motion as long as you can. So I understand Pai is doing twina classes, okay? This may be only 20 seconds. Again, this technique is extremely strong, but it works very fast and is unequivocally efficacious, no, for this type of shoulder pain. It is similar to the auricular treatment in that massage is used, okay? And this is very ideal for frozen shoulder. And you may choose to needle this point also. But since I am an advocate of auricular acupuncture, I would use this LI15 on the ear, okay? The point can be needled perpendicularly into the joint or obliquely down the arm. So like away, no? Going down. Choose a perpendicular insertion if it is a joint problem, or if the upper arm muscles are involved, you use an oblique insertion. Insert the needle 1 to 1.5 soon, perpendicularly, or obliquely and subcutaneously down the arm to the same depth, if it is muscular, no? And disperse the point. Even though needling is unilateral, this is a powerful needle technique, and it has a strong bearing down sensation. We find that patients prefer the twina to the needle technique for this differentiation of shoulder pain. So if you have undergone training on twina, then make most of it. Okay, this is very good for frozen shoulder. And the last one is threading. This is another classical Chinese option. And we thread stomach 38 to bladder 57. Okay, so we need to know the location of stomach 38 and bladder 57. Now, bladder 57 has the property of relaxing the muscle channels. And the stomach 38, which is very close to stomach 37, is called the lower Hussey point of the large intestine, and it has an effect on the shoulder. In combination, they assist in the treatment of shoulder pain. Now, if you will use needles, you puncture stomach 38 obliquely because you will be pointing towards bladder 57, okay? You use a 2 to 3 inch needle, but you don't have to insert all of it. Unilaterally, you insert only like 1 to 1.5 soon on the right leg, since the stomach and large intestine energetics are more right-sided, okay, as can be seen in the pulse system, where the stomach and large intestine appear in the right pulse. Or sometimes you do the balance method. We shall discuss that if somebody asks later. Even though the depth of insertion is relatively deep, this should not be a painful insertion. And this time you have to use an insertion tube, the guide tube. Okay, simply tap the needle into the epidermis and then slowly insert to achieve the through and through technique. Now, when you are at the proper depth, keep manipulating the needle with a combined lift and thrust and wide amplitude technique. Remember, you are sedating, no? At this point, because you are deeply embedded in the musculature, the manipulation of the needle will feel heavy and sticky, and this will produce a strong sensation in the leg. And you have to let the patient know this, okay? Manipulate the needle for half a minute or so, then remove it, and have the patient mobilize the shoulder. Remember, 30 seconds, less than a minute. often you will see significant improvement. This technique can be used for arthritis of the shoulder, as well as peripheral inflammation of the shoulder, periarthritis. Okay, since I am a little bit biased on auricular, so these are the points that we needle. So this is the ear acupuncture counterpart for stomach 38, and this one is for bladder 57. Okay. Now, point location reminders. Let's go through all the points. LI15 is antero-inferior to the acromion, in the middle of the upper portion of the muscle. I'm sure you're all familiar with the deltoid muscle. When the arm is in full abduction, the point is in the anterior depression of the two depressions. The other one is TB14. No? The point is in the anterior depression of the two depressions appearing at the anterior border of the acromioclavicular joint. And this is the counterpart of the LI15 on the ear. Lung 7, superior to the styloid process of the radius, 1.5 tsun, above the transverse crease of the wrist in the depression on the styloid process of the radius. So on the ear, it's located here. So you have to use your ear probe. And stomach 38 is 8 tsun. Okay, this is actually in the middle, no? 8 tsun below stomach 35 and 2 tsun below stomach 37. Midway between stomach 37 and stomach 41. Okay, so this is bladder 57, which is directly below the, what do you call this muscle? Gastrocnemius. Okay, the belly of the gastrocnemius muscle. On the line connecting bladder 40 and the tendocalcaneus, about 8 tsun below bladder 40. Okay, and we also call bladder 57 as a Madan Yang heavenly star point. It is an important local point with a distal effect on the lumbar and anal region. Bladder 57 is a major point for muscle cramps, and this point can free up the chi and relax the sinews, as we mentioned earlier. Okay, and we also use this for swollen and bleeding hemorrhoids, feeling of heat in the head, lumbago, sciatica, rectal prolapse, or for pain in the sole of the foot and heel. Okay. You can also use this for those who have a tendency towards gluttony. Okay. Promise it works. Gluttony. Okay, so perpendicular insertion 1 to 2 tsun. So for the ear, this is where it is located. So it should be somewhere here. Okay. And finally, we have the shoulder ear point, which is located in the scapha, level with the crus of the helix. But again, you don't need to be very precise with this location. You have to use the ear probe, okay, for accurate location. And the shoulder joint, ear point, which is located in the scapha, midway between the shoulder and the clavicle points. So, to summarize, to conclude, these are simple yet comprehensive treatment strategies that have known clinical efficacy in the treatment of shoulder pain. Only one needs to be used at a time. Wag naman lahat. They work, the treatment is fast, and the results are long-lasting for the patient. As always, these techniques are a testimony to the interrelatedness of body systems and the sagacity of Oriental medicine. But again, you need to have a very comprehensive examination. You should be able to look at the tongue of the patient, feel the pulse, and be able to identify the pattern that is behind the problem. Thank you for your attention.
Thank you, Dr. Hector, for that wonderful presentation, and
Thank you.
also not only covering one but four treatment modalities, as well as our with our auricular therapy. I mean, so I would like to also simply add, from a standpoint of a practitioner, it's also important to know the pain scale of the patient, because pain is a very personal experience. So a level of pain from one person to the other would differ. So you can simply use what's commonly known as the 1 to 10 scale. So you're going to ask the patient on a scale of 1 to 10 for you, how would you rate your pain or your discomfort right now before the treatment and after the treatment? So it becomes not only a more personal experience, but also a gauge from the practitioner standpoint if there has been any relief. So also, when we document things, then at least we know that the patient is aware that it is more towards directed towards their care instead of what we try to achieve as our own personal standard, but it's going to be based on a personalized care. So if the patient starts to said, well, and when I move my shoulders, I would say it's about an 8 on a 1 to 10 scale based on my scale. And then later on after the treatment, so how would you rank the pain right now based on a 1 to 10 scale? If it goes anywhere from 2 points down, then you actually have achieved a milestone in the treatment. So that's the only thing I would like to add based on a standpoint also a practitioner. I don't see any questions on the chat box. Oh, there's one from Victor Ginto. On stomach 38 and BL 57, is it also ipsilateral needling?
Um, it depends on on your analysis, on your assessment. As I mentioned earlier, if it is uh okay, if you're an advocate of the balance technique, in which Dr. Gavino is an expert on, um, you would usually use the contralateral technique. But again, you only use the contralateral technique if you are quite sure that the large intestine channel is involved. Otherwise, you do the same side, the ipsilateral needling. I think we have made it clear earlier how to determine if it is a large intestine involvement. You ask the patient to abduct or the arm. And usually if you see that the location of the pain is towards the large intestine channel. Yeah. That's, does that answer your question? Yeah, okay, there's a down. Will it be okay to needle? Yeah, no one will know. Gusto ko yan, sigurista. Okay. Yeah. Or if it doesn't work, try the other side. That's a good one. Okay, thank you very much for this, Dr. Ryan. Uh, uh, take find time to really take a look at the how we could quantify the pain, okay, from a 0 to 10 scale. Yeah. And most of the time, the patient who comes to you are those who have tried other modalities. So make sure that your treatment is impactful.
There's
Thank
another
you.
question, Doc Hector. Do any of you practice the threading technique?
Okay. As I mentioned earlier, I'm more biased to the auricular technique. Should you decide to use the threading, this is not actually threading all the way through. No, it's just if you were listening earlier, I said you can use a 2 to 3 inch needle or longer, but you just have to needle at least you puncture only to a maximum depth of 1.5 soon. And in the case of stomach 38, you have to be doing it obliquely, pointing towards bladder 57. Okay, but it doesn't necessarily mean that you have to go. It should give the patient a through and through feeling. So it doesn't necessarily mean that you have to like use a very long needle and see the other end of the needle at the other side. No. How would you deal with toxic patient with regards to okay, this is a good one. Okay. This is where the importance of knowing the five-element constitutional or the causative factor of the patient comes in. Okay. First, you have to be likable. Okay. And usually the toxic patients are those who are perfectionists, those who don't seem to be satisfied, and would need a lot of you need a lot of explaining. Okay. So what I do, I try to assess, no? And what makes this kind of people, the toxic people that you describe, very toxic? It's because they have an issue, no? And these are very irritable. This is where, of course, if they are very wood element, you would expect them to be very irritable. Okay. And okay, then you need to find a way on how to make the patient like you. Okay, since they are perfectionists, always uh, emphasize from the very start of the treatment, before the treatment, that we cannot treat this in one single session. Okay, that's why you need to be able to know this, the scale, the pain scale that Dr. Ryan provided. Okay. In my experience, I haven't come across a patient who said that there was a zero, it was a zero already. No. You should congratulate yourself when you see a 50% improvement. So if a patient comes to you with an 8, you should be very happy when he or she would tell you it's a 3. Okay, and celebrate. And you also should consider there are people, um, I don't know, you need to develop a technique which you don't really find in books. Okay. If you are dealing with a toxic patient, hard to deal with patient, then first you have to be likable yourself. Okay. Um, Try to be as down to earth as possible without sacrificing your dignity. And don't promise anything. Okay. I hope that helped. Or probably you need to uh, brush up more. Okay. Um, Maybe try to talk a little bit about, because when you have to have a very thorough history. You need to know, like your patient must be good at, must be very fond of golf, or must have an emotional issue. Okay, which happens in most patients who have liver G stagnation. Yung mga ganon. Okay, so we can probably, have a separate webinar for that.
Thank you, Doc Hector. There is Maria Wilma Villaba wanted to share that I experienced adutuina on her shoulder and neck dahil takot sa needle. Then she feel na nanginit ang pakiramdam niya buong batok.
Yeah, kailangan talagang uminit. So congratulations, Ma'am Wilma, you did it. So una-una, okay, as I emphasized earlier, you need to already make it clear from the very start. Kailangan uminit yung batok. Congratulations, ang galing siguro magtuina ni Ma'am Wilma. I'm not a fan, I don't know, because siguro medyo hindi na tayo bata, no? But it's amazing. Congratulations po. In fact, I'd like to attend one session on tuina. I'm excited.
I'm also glad that you pointed out, dampness is the reason for shoulder pain, because that is the reason why I actually went to Dr. Hector as a personal
Yeah.
experience. And even on the first couple of sessions, it was almost like a day and night difference. So then that's what led me to seek and learn acupuncture.
Yeah, if you've seen him before, I am not allowed to show his pictures. But there is one thing that is still a problem for us. His being a gourmet, no? He
Yeah.
loves to talk about when it comes to culinary matters. He's the person to talk. He's the person to consult. Okay, so ay wala na. Please feel free to ask. We still
You
have a
can
lot.
also get off mute if you want to ask
Yes,
or
you
make
can you
a
can actually
comment.
ask directly.
Anybody would like to share their experience, personal experience with shoulder pain
Yeah.
that has actually experienced one of those modalities?
Mm-mm. Siguro what you would like to ask is what's the most common cause of shoulder pain? No.
Mhm.
Um, First you need to consider the age. Okay? Yun. And age is very, very important. There are people who look older than their age. So these are the people who have probably worked so hard when they were younger, and this time they're paying for it. Okay. And so you need to focus more on the yin deficiency aspect because when you have too much yin deficiency, remember you can have heat, right? And the heat can actually congeal the fluid, so you'll have phlegm. So these people might also have shoulder pain, especially when they start developing bad habits, no? Yung bang mahilig kumain ng masasarap, ang tigas ng ulo. But I'm not saying that you have to refrain from eating those kind of food. It's just about not indulging too much. Yun lang. We all deserve to be happy. Okay. What to do if nakaramdam ng contraction sa muscle? Kung nakaramdam ng contraction sa muscle, that means medyo hindi po siya maganda. Okay, so you have to relax the muscle. So you would want to use bladder 57 or bladder 40. Yun. Okay? It's a very good muscle relaxant. Kailangan hindi po siya mag-spasm. Okay? Yes.
Yep.
Okay, so the age, let me continue.
Ah,
While we're waiting.
I was just
Yeah.
noting it in that way everyone could see it.
Yes. And I tell you, in my experience, phlegm, dampness is a very common cause. Okay? So you will have to ask, like, I have one Australian patient from Melbourne. If you've been to Melbourne, you would know that it's so cold there. It's like every day, nandun lahat ng food. And he was a beer drinker. Of course, he can't help it kasi, it's so malamig. So he had this shoulder pain. He was a truck driver. And so I don't know if he felt bad because, of course, nobody would like to drink beer that is not cold. So yun. So I tried teaching him how to, try to not drink too much cold drinks. So it's just a matter of giving up what you love doing so much. Okay, I'm not saying that we will all try to avoid eating the foods we love, but it's just a matter of like doing it like once a week or every 2 weeks. It will not hurt. So the first one is age. While we're waiting for the questions to come. Um, so iron deficiency can actually, yeah, of course, when we're not young anymore, we always look at the kidney and the liver. And remember, the kidney and liver, they have a mutual relationship. And let's face it, we will all grow old someday, and some will grow old faster, especially if they've been, um, you know, if they have so much responsibility when they were younger. Okay, so um, all these problems will come out when you retire. Okay, because now you can do whatever you want, indulge, indulge, indulge. So phlegm, phlegm, phlegm. And remember, phlegm is very impactful on the circulation. Another very common cause is cold. We're very lucky because we don't live, yeah, we are at the near the equator, diba? So very tropical. But again, a lot of people, when it's too hot, they tend to drink cold water. Okay? You just have to avoid drinking cold water. So I was very happy because every time I have lunch with Dr. Ryan, he would always request for warm water or hot water to start the meal or a bowl of hot soup. Diba? Effective. Any other, and of course, you just don't discount the fact that there will be cases that they might have previous trauma, no? Especially if there are athletes, no? Football players, or their occupation makes use of the shoulder a lot, like if you're a hairstylist or anything that makes use of these are the things that you have to consider. Okay? So, of course, you cannot just tell them to give up what they're doing. This is where educating the patient comes in very, very handy.
Doc, question po.
Yes, Ma'am Joy, how are you? How's
Ah,
Baguio?
hi Doc. Cold. Kaya yata po masakit yung shoulder ko. Pero Doc, I have a question. Since some patients na may shoulder pain, they use either a ice pack or a hot pack. Which would you, parang, which is better? Which one is better to use?
Okay, obviously, if the shoulder pain is due to cold, you don't use a cold pack. In fact, it will make the pain worse. Okay? Uh, you would use a cold pack if there is swelling, inflammation, or there is redness. Okay?
Mm.
Case to
So,
case, not
Doc,
all
kung kunyari,
shoulder
pag
pain.
due to injury, yung and not due to a pattern, not due to cold, but an injury.
If
Pero there's no swelling, but there's pain.
Yeah, there's pain because of blood stagnation. So a very hot, uh, that's why you need to know how to relieve the pain. So you have to invigorate the chi. Okay. Obviously, if you will use cold ice pack, it will make the pain worse. So the idea here is for you to improve the circulation. So you have to look at the tongue. If you see that the tongue is so purple, but there are two types of purple tongue. One is reddish purple. That means the purple is due to heat. Bluish purple, that means the tongue is due to cold. So again, you need to employ your skills on pulse taking, pulse diagnosis. Okay?
Doc, like kunyari ako ang problem ko dun sa, dun sa gusto ko sanang i-treat. So, ayaw niya magpatang diagnosis.
Di feel mo yung pulse niya. Usually
Pulse
kasi
na.
pag cold,
Ang hirap, Doc.
medyo tight ang pulse. And of course, hindi siya mabilis.
Mm.
So, syempre kung mabilis yung pulse niya, tapos ang mukha niya ang pula-pula,
Cheap, Doc.
hit yun. May benefit yung ice pack mo. Okay?
And other than the ear seeds, Doc, is there other ways na, kunyari before ng next session,
Yeah, good
to alleviate
question.
the pain?
Yes, ang dami, no? Okay, kaya have to make friends with Dr. Gavino. He's an expert. You can use scalp acupuncture. So isn't that
Ay, Doc, ganun na.
Yes. So he knows how to relieve shoulder pain using the scalp. I think both the traditional one and the Yamamoto new scalp acupuncture, INSA they call it. He's an expert on that. Or you can use abdominal acupuncture, no? And you can also do gua sha. But again, you have to avoid, okay, the best technique is, of course, if you have shoulder pain, don't immediately attack that area that is painful. You start with the distal points. And this is where you have to make use of the textbooks that we gave you.
Yes, Doc. Ang Liza.
Meron pang iba, Ma'am Joy? I hope you're happy.
Yes, Doc.
Okay.
Di ko lang po kasi kung may question si Ma'am Jeliza eh. Kaya,
Oh, yeah. Ma'am Jeliza, would you like to, okay, our experts sa anatomy. Oo. So I presume alam mo na yung mga muscles involved when you have frozen shoulder. Ano, I'm sorry, rotator cuff injury. O, di ba? Memorize niya yan. I hope you had fun during the anatomy and physiology practicum. Obvious naman na natuwa kayo.
Yes, Doc.
The
Very.
practicum.
We missed you though.
Yeah, thank you. Yeah, but you have a very good mentor, Dr. Webb. And I was happy because she was able to share with you the art of needling. Yun naman ang the reason why, while waiting for questions, wala naman talagang question. Okay.
I will alert you if there's a question.
Okay, please. Okay. So if, okay, the reason why um, we have anatomy and physiology is because we need to be very precise with our needling. Okay, location is very, very important. And the familiarization with anatomical structures is of paramount importance. And I hope you're looking forward for more.
Yes, Doc. Always.
O, diba? Parang doktor na rin kayo. Okay. What am I going to talk? Do you have any question, Dr. Rai? Or maybe
Well,
you want to go?
I actually just wanted to share earlier about my
Oh, yes, please.
personal experience because of the relevance to the topic. So, no, it could be because I still enjoy going to the gym. So, I do get the shoulder pains every now and then, but knowing points to massage and, especially just knowing whether it is from my eating, which is the dampness part, or was it just pretty much mechanical. So yun lang, you just have to learn what the cause is,
Mm,
and no one else could. Nothing else is more important than assessment by looking at the tongue, and
yes.
also the pulse, and also inspecting the area.
Mm,
Kasi if it is due to an injury, most of the time, mamumula yung area or becomes a
mm,
little bit swollen, and definitely you have stagnation. That's when you could initially apply warm compress.
Copy.
Yeah. Yun
yeah.
lang po.
Thank you very much, Dr. Raya. Please ask questions. Okay, Ma'am Wilma, are you happy with the answer? Dapat hindi po mag-contract yung muscle. Kailangan na-relax. Don't make it too obvious that you committed a mistake. Huwag mag-panic.
Yes, Doc. Doc, kasi noon, ginamitan ko yun ng myofascial release.
Ah,
Tama ako doon sa, opo, doon sa dalawang shoulder. Yung isa, na-relieve ko po. Pero yung isa, siguro po baka sumobra lang ang baon ng needle.
Mhm.
Kaya, pero yung other shoulder po natanggal. Kaya amazed po siya eh. Yun lang dun
Wow.
sa isa, sabi niya, bakit parang nag-contract ang muscle ko? Inalis ko po kagad, tapos minasage ko.
Baka
Natakot
na ano
ako.
lang, na-stimulate lang. Ibig sabihin na buhat. Yun.
Hindi ko po alam. Basta po,
Kasi
inalis ko na lang.
basta hindi lang siya mag-go into spasm or something. Kasi
Opo.
iba yung muscle cramp.
Opo.
Maraming
Opo.
salamat po. Congratulations.
Thank you.
Okay. Meron pala. Yeah, we have something from Sardino. Oh, yes. Palpation.
Yes.
That's why it's a must that we should know a little about Twina. Kaya congratulations kay Ma'am Wilma. And Sardino is a PT. So a little extra manipulation will not hurt. And the patient would really love you for that. Yeah.
Actually, Doc, I'm glad na si Sardino said that. Kasi I
Mhm.
was gonna ask, ano ang scope nung shoulder? Hanggang sa baba po ba ng scapula? Like, since it's the shoulder blade and all that? Or is this just talking about like the top of the shoulder?
You always start distally, no? Oo, kasi do not immediately proceed to the Ashi point. Okay? And ako kasi I prefer needling. So, Or magwa siya. Pero yung gwa siya, you have to be careful. Baka lalong
Pero Doc, yung question ko is like, yung when we talk about yung points na binigay nyo kanina, is it, anong scope ng shoulder yun?
No, hindi. Una-una,
Kunyari, Doc, ako, ang masakit sa akin, shoulder blade, ganon. Same din po ba yung points?
same din. But again, you have to address the other issues. Parang overall siya. Parang, you know, you're looking at the situation using, parang kang ano, you're looking at the forest. Hindi doon sa mga trees.
Inside pa.
Hindi pa, later na yung inside. Kasi you need to, 'di ba? Like this is just the quick approach, no? Especially when you do it sa sa mga medical missions, no? You do not expect to spend like 1 hour on a patient, no? So, but sa actual practice, you need to also address the chronic issues, especially if matagal-tagal na din yung kanyang shoulder pain. And I tell you, ang daming may shoulder pain.
Yes, Doc. Madami talaga.
And if you go deeper, shoulder pain yan eh. You need to identify, ano ba itong problem? Is it acute or is it chronic? So the points to use would be different. Although it won't hurt naman if you use the points sa chronic. But again, it's the idea here is to be able to address the chronicity of the problem. No? That is, kung ayaw mong pabalik-balik ang pasyente. Because it would be very embarrassing. Just like my patient yesterday, kanina pala, sabi niya, I've tried it like ganon, sa mga, wala daw nangyari, 12 sessions nag-commit. So don't promise. So if you, kailangan kasi dramatic yung change like first 3 sessions. So kung hindi pa rin maganda, and don't keep doing the same thing over and over again for all 12 sessions, the same points. This is where your skill in assessing the patient comes in. Kung nakita parang wala kang nangyayari, baguhin mo na. Meron ka namang time mag-review, just don't make it too obvious. Yun. Ako kasi less is more. And of course, do not, kasi most of the patients who will come to us are chronic, no? Remember, they have tried other modalities. They have their own MDs, okay? And usually naka-pain reliever lang yan, no? And then you have to listen to the voice of the patient. Just like my patient kahapon, medyo maiyakin siya, no? Sabi ko, ay, okay. For 15 years, gusto niyang makawala. Sabi ko, are you saying that you would like to end it? Because that's not fair. Because you just don't side with the patient. You have to consider, like, it takes two to tango, di ba? So sabi ko, let's look at it this way. Maybe there are things that hindi mo pa sinasabi sa akin na no? Hindi naman tayo psychiatrist. And please don't act like one because we're not a psychiatrist, no? But again, dito mo mapi-feel na talagang there's an emotional component involved. So the patient cried 3 times. Let the patient cry. Ganon. So, for all you know, yung shoulder pain, again, you have to also consider the work, no? First and foremost, yung work niya. Baka naman pa yung ano niya, yung posture niya habang nagko-computer is, dapat kasi eye level when you use the desktop, no? Hindi yung nakaganon. So if di ba, let's face it, some of us or most of us would spend like 4 hours tapos nakaganon. And I think Dr. Ryan has something to share. I just forgot the figures. Na yung bang parang ilang kilo. Yeah, remember
Whenever
that?
you use your cell phone, the angle of your head, if it angles about 5 degrees na stoop, it equivalents to applying 5 pounds of pressure on your neck. So kung mag 10
every
degrees na
angle.
naman, as you're using your cell phone or you're using a gadget, so 10, it's the same force of 10 pounds. na nakabitay sa leeg. So in other words, if you use it on eye level, it doesn't cause any strain on your neck. So most of the time, even yung ano lang, yung angular position sa head when you're using your gadget, we find this especially more sa when they work sa ano, like call center. And then also those that are avid users of cell phones. I mean, it is what we have to admit. It is it is what it is nowadays na cellphone talaga. Pero yung angle you can change kasi pag 5 degrees ka, it's like 5 pounds of pressure on your neck. And then 10 degrees, it increases as you stoop. Pag ganun na angle, 5, 10, it increases by 5 pounds. So imagine that on your neck for 3 to 4 hours.
Yeah.
Minsan na kung nakahiga ka, hindi naman pwede kasi mabablock eye ka sa cellphone mo. There's ano po, Doc, there's gusto mag-share si Ma'am
Oh,
July.
sure. Please go ahead po.
Hi, good afternoon, Doc.
Ay, good afternoon, Ma'am Juliza.
Ako umayos naman.
Sige, go.
Ako lang po kayo yung approach, ko po sa frozen shoulder. Yung kasi po yung chronic na po yung frozen shoulder ng asawa ko. Napansin ko po kasi yung pagpayat ng muscles niya, tapos yung frozen niya sa shoulder niya, matagal na yung ininda. Marami na akong ginawa treatment doon sa shoulder niya, lagi niya. Tapos yun nga po, nalaman ko na diabetes siya. Alam ko po kasi pag diabetes, sinisira din yung kidney. So yung kidney po, di ba may kinalaman din po sa
tama po kayo doon. Actually, spleen and kidney yan. Deficiency. Okay? Equals dampness. Ay, nawala si Ma'am Juliza. Hindi nakikita yung mukha mo, Ma'am Juliza.
Signal po siguro.
Yeah, mukhang mahina. O baka gustong i-echo ni Sir June yung sinasabi. Okay. Please unmute your mic. Andyan na. Ay, magkasama sila. Hindi pa yata nakauwi.
Unmute please. Pwede ma-unmute?
Sir June, unmute your mic.
Paano ba?
Okay na po.
Hindi pa po yan. Kasi nga po yung symptom, masasakam po ng diabetes. Kasi po chronic pa po. Tapos nga po yung diabetes niya, nisira nga po yung kidney, diba? Dahil sinaraman dito sa dito. So yung niya, ito nang gawin pang treatment na ginagawa. Walang nangyari. Tapos, umasal niya sa bahay sa exercise. Ano siya, parang contrast? Contrast na. Ewan. Ano po pwede pa gawin? Retraction? Ayaw ko yung mga sariling yung home remedy. Ano lang yan, hagod lang. Ay na po siya, na-save po siya ng 50% po siya. Nakakaroon po siya sa 50 plus. Ang gusto ko lang po, sir, ano po previous na pinakagabi? Ginawa ko po nila po. Ayaw pa sa aray ko. Saka sa LI-10.
Okay.
Aray ko. Yan sa sample nila malaki. LI-4, LI-5, saka pamakasagot po siya ng LI-3 yan. Tapos LI-10. And sabi ko sa social. Kaya na po na
ay, wow.
aw, aray ko. Puro hapon po saka pressing lang. Kasi lang ginagawa ko sa kanila. Kasi nga matagal niya po ng professor. Gawa na nga rin po ng yun lang po.
Maraming salamat, Ma'am Juliza, for sharing. More power. Si Sir June, baka may gustong i-share.
Ito daw. Ako po, Doc.
May gusto kang i-share?
Ah, kanina po sa medical mission, iba naman po yun. Frozen shoulder din po siya. So, ang nangyari sa kanya parang siguro minamin using massage po, ginano nila. Pero wala pa rin pong pagbabago. So, ang ginawa ko po, pinalabas ko po yung emosyon. Ayun, nagalaw niya yung
Oh,
nagalaw
diba?
niya yung pala.
Galing.
Ang nangyari po, sa, nakita niyo umiyak, no? Pinaiyak ko po kasi nilabas niya lahat ng sama ng loob niya. So, ang nangyari, na-release niya, nagulat
Ang
siya,
galing. Oh,
naigalaw
diba?
niya na. Opo.
Wow. Congratulations. Yeah. So,
Opo.
yes. Thank you very much po. So, sabi ni
Opo,
Dr.
Doc.
Ryan,
I was just trying to rephrase what ano ni Ma'am kanina.
yeah. Kaya nga that is why I always emphasize the importance of using the back shoe. You need to be able to address what is causing the problem. And the back shoe kasi, the impact is directly on the organs. That is the reason why we need to study the vertebra, diba? Para we would know how to accurately locate the back shoe points. Okay, so I think that's about it. Nobody is asking any question. I hope everyone is happy. Unless you have some question, Dr. Ryan?
No, thank you. It's been a very a great learning experience. And then others might also ask, when will the recording be available?
Very soon. When we're done, give me about an hour or two. Yes. So thank you so much.
I think, Doc, walang questions kasi it's very quick and informative.
Yes.
Straight to the point.
Magkaibigan lang talaga tayo, Ma'am Joy.
Sana forever, Doc.
And I miss your cupcakes. Oh, di ba? I hope you can come up with cupcakes na hindi dumb.
Sana nga po, Doc.
Sige,
If there is.
Maraming salamat po. And you are all, and we're really proud of you. Mukhang nag-sink in na lahat yung mga pinag-aralan natin. So if you notice, we don't give long lectures. Siguro naman sa dami ng video. Thank you po sa ating mga presenters. I don't know how I could, thank you. I really don't know how to thank all of you, no? And for showing your support to what we're doing. And we hope that because of this, we can see the light of day. So that means ma-realize ni Dr. Palanca yung dream niya that we will align ourselves with the medical people in the hospital. So it's just a matter of leveling up, diba? Oh, take a look at Dr. Ryan. Ang dami niyang doctorate degree. In fact, he's thinking of earning another doctorate degree. Doctor.
Boredom.
Yeah. So
culinary arts na lang.
yeah, never stop learning. Okay, this should be an endless and always be updated with the latest. Okay, so yun po. So again, we would like to thank all of you for joining. Keep posted for more lectures of the. Are you happy, all of you?
Yes, Doc.
Maraming salamat po.
Thank
Okay.
you so much, Doc Hek and Doc Ryan.
Yeah, we
You're
will
welcome po.
appreciate if you can suggest a topic that worth discussing. Okay? Para alam namin na yun talaga ang gusto nyo.
Lower back pain.
Oh, okay.
Yes.
Sige. Maraming
Kasama
salamat.
kasi
Or back pain in general.
sa statistics from PSA, Philippine statistics, those are the top main concerns is the neck, shoulder, at saka lower back.
Yeah.
So might be
That's
a good
exciting.
tandem to
Sige. Next time will be low back pain. Easy approach. Maraming
Yes.
salamat po.
Thank
Thank you
you.
for your time. I know,
Ito rin po.
congratulations po sa LAMP team for very successful mission.
Team daw.
Maraming salamat po. Thank you, Dr. Ryan, for moderating. We learned
My
a lot.
pleasure.
Thank you so much. So, end ko na po. Maraming salamat.
Thank you, Doc.
Have a great
Good,
weekend.
everyone.
See you soon. Bye-bye.
Okay, thank you.